Common questions about somatic symptom disorder. What is somatic symptom disorder? Somatic symptom disorder is characterized by one or more somatic symptoms that are distressing or result in significant disruption of daily life. Excessive thoughts, feelings, or behaviors related to the somatic symptoms or associated health concerns as manifested by at least one of the following. Disproportionate and persistent thoughts about the seriousness of one's symptoms. Persistently high level of anxiety about health or symptoms. Excessive time and energy devoted to these symptoms or health concerns. Although any one somatic symptom may not be continuously present, the state of being symptomatic is persistent, typically more than 6 months. What are the causes of somatic symptom disorder? Somatic symptoms may result from a heightened awareness of certain bodily sensations, combined with a tendency to interpret these sensations as indicative of a medical illness. The underlying cause is unclear. Risk factors include childhood neglect, sexual abuse, chaotic lifestyle, and a history of alcohol and substance abuse and personality disorders. What differential diagnoses should be considered for somatic symptom disorder? The following diagnoses should be considered in patients with suspected somatic symptom disorder because the symptoms may be indicative of other mental health disorders. Depression, panic disorder, generalized anxiety disorder, substance use disorder, syndromes of unclear etiology, and non-psychiatric medical conditions. How is this condition being managed? Use the CareMD approach to somatic symptom disorder. Consultation. Consult and collaborate with mental health professionals. Assessment. Evaluate for other medical and psychiatric disease. Regular visits. Schedule short-interval follow-up to stop overuse of medical care and avoid the need for symptoms to get an appointment. Empathy. Spend most of the time listening to the patient and acknowledge that what he or she is feeling is real. Medical-psychiatric interface. Emphasize the mind-body connection. Avoid comments such as "there is nothing medically wrong with you." Do no harm. Limit diagnostic testing and referrals to subspecialists. Reassure patient that serious medical diseases have been ruled out. Are medications effective in treatment of this disorder? Amitriptyline and selective serotonin reuptake inhibitors are effective pharmacologic treatments for somatic symptom disorder. Other antidepressants, anticonvulsants, and antipsychotics are ineffective for the treatment of somatic symptom disorder and should be avoided. What is the prognosis? Somatic symptom disorders are generally chronic, with waxing and waning symptoms. The natural history of the disorders suggests that approximately 50% to 75% of patients with medically unexplained symptoms show improvement, whereas 10% to 30% deteriorate. Better prognostic indicators include having fewer physical symptoms and better functioning at baseline.
Audio Jungle. Audio Jungle.